Good afternoon, everyone. Welcome to the fourth event in the 2022 Healthy Working Life Seminar Series. Today's topic is, what does a healthy truck driver look like? I'm Dr. Ting Xia, a research fellow from the Driving Health Research Team at Monash University, and I will be your MC for today. Before we begin the seminar, I would like to welcome all of you to this seminar. It is our privilege to have you with us today. We acknowledge the sacred land of the Wurundjeri people on which we are based and pay our respect to the thousands of years of wisdom and knowledge found with the indigenous owner of the land, Womanjeka. Welcome. In today's seminar, we have 4 guests that I'd like to introduce. First is the lead researcher of the Driving Health Project from Monash University, Associate Professor Ross Iles. We also have Professor Shantha Rajaratnam from the Monash Sleep Network, Darren from Aussie Health, and Professor Dan Lubman from Turning Point. For today's session, Ross will begin with a short presentation around the driving health finding relating to the driving health, the Australia truck driver's health profile, and this will be followed by a panel discussion with Shantha, Darren, and Dan. There will be a short Q&A at the end of the session. However, throughout the seminar, you can submit questions through the Ask a Question button, which is located below your live stream box on your screen. We will be answering some of your questions along the way as well. Scroll down to find this button and feel free to ask questions at any time. Right, let me hand over now to you, Associate Professor Ross Iles. Thank you, Ross.
Thank you very much, Ting. It's great to have everyone here today. We are talking today about what does a healthy driver look like. And this is the 4th of 6 events in the Healthy Working Life Seminar series, all about driving health. So what I'm going to do today is run through some of the findings that we found in driving health that are relevant to the guests that we have today. And as Ting mentioned, we've got a great panel lined up with real expertise, with factors that are real challenges for truck drivers. Now, all of the seminars that we're running, they're recorded and they're available freely online. Just go to drivinghealth.net for the details. And the same with all of the information that I'm presenting in terms of the results of driving health. All of that information is available on drivinghealth.net. If you have any questions, please get in touch with the Driving Health team. We'd be more than happy to help. Now, just to give a quick background about what we're talking about today, throughout driving health, we measured information from a range of domains or areas that impacted truck drivers' health and well-being. We collected information around the personal domain, so about the driver themselves, about the occupational domain, so the factors around the type of work that drivers do, and the environment that they work in. We know for drivers that's pretty particular in terms of the cab of the vehicle that they drive, but then also the delivery centres, etc. We really focused our outcomes looking at health in terms of psychological distress and general health, but we also asked drivers about the frequency of near misses and actually their own self-rated ability to do their job. All of these things happen within the regulations that apply to driving. And what we're focusing on today is a number of factors that occur in the personal domain, and in the lifestyle domain. And we've got some real experts to chat to today. So I'm going to present a couple of the findings around those things, particularly around sleep and fatigue, substances and suicide. And we'll go through that data and then we'll have a chance to chat with the experts. So in terms of sleep and fatigue, the information that we gathered during driving health was to ask drivers how often they actually became fatigued while driving for work. And you can see there that 23.3% daily or almost daily said that they became fatigued while they're driving for work. And so that's, nearly a quarter of drivers daily are battling fatigue when they're at work and driving. We asked drivers also in the past month how many nights per week did they have problems sleeping. And you can see there that nearly 50% would sort of said in the last month was only sort of 0 or 1 night, maybe they had difficulty sleeping. But for a group of drivers, nearly just over 20% or 1 in 5 drivers had problems sleeping 5 to 7 nights over the last month. We asked drivers how many times they unintentionally fell asleep during the day in the past month, and 2.3 days was the average there. And quite concerningly, 11.1% or 1 in 10 of drivers have nodded off or fallen asleep while driving. So clearly, sleep and fatigue is a big issue for truck drivers. That's not particularly surprising, but what we're able to do with Driving Health is actually wrap some numbers around that. And that's an ongoing issue for drivers themselves, but also people who look after drivers. We also, through Driving Health, asked drivers about any substances that they use. And we asked drivers, did they actually use any medication to combat the fatigue that they faced while they were at work? And many drivers, sorry, the numbers cut off a little bit there, but 56.9% reported drinking caffeine, so some coffee or an energy drink was something that actually helped them to combat fatigue. The next approach, if you like, was to have something to eat or something else to drink. As we go further down the line, we actually start to get into medications, and 3.1% actually told us that they took amphetamines to combat fatigue. And in our sample of 340 drivers, thereabouts, who completed this part of the study, 95 had taken something to combat fatigue in the past 12 months. So drivers are putting in place, they've got their own strategies at times to actually deal with the fatigue. And drivers have told us that there is a lot of pressure for them to still be on the road, even when they're feeling fatigued. We asked drivers in the past 12 months, how often did they have a drink containing alcohol? You can see there that there's quite a distribution amongst drivers in terms of how often that they would drink alcohol in the past 12 months. 13% don't drink at all, and 20% or 1 in 5 drink less than monthly. So from an alcohol perspective, there's not a huge amount of alcohol intake, or drivers aren't telling us that they're heavy drinkers. We're going to move next on to some causes of death information. This is information that we drew from life insurance data. We were actually able to look at fatal claims from TWU Super, the major life insurer in the transport industry. And when we look at the major causes of death by age group, we can see sitting at the top there is an external cause of injury as being the most common for drivers under 40 years of age. That's usually referring to crashes or accidents on the road. But sitting below that in second place is suicide as the second leading cause of death or death claims for drivers under the age of 40. This figure is potentially a little bit misleading because suicide then disappears off this leaderboard of causes of death, and it's replaced by cardiovascular disease hitting the top. And the external cause of injuries in terms of crashes seems to happen less often, but we start to see cancer rising to the top. But what's happening here, we've got these lifestyle diseases, if you like, that cardiovascular disease. We know drivers find it difficult to access healthy food, difficult to exercise. So they have a large number of risk factors for developing cardiovascular disease and other diseases like that. When we actually looked a bit more carefully at the number of claims for suicide in the different age groups, the raw numbers of suicides doesn't actually decrease as drivers get older. It's actually more that those other factors, those cardiovascular diseases and cancers, actually become more prominent as drivers get older. So suicide is an underlying risk for truck drivers, not just young drivers. It still maintains there are a large number of drivers taking their own lives as a result of the pressure of the job. And so I just wanted to put some things here in drivers' own words with some of the factors that we'll be talking about today. The first one, sort of talking about being right at the edge of your fatigue zone. And in the situation where you simply don't have an opportunity to pull up. And you've just got to, you're fighting the fatigue, but you're on a 3 to 4 lane highway. There's nowhere to pull over. And if you do pull over, you're at risk of a fine if you do, because it's not an appropriate place to stop your truck. And another, the second quote there is actually about the rest areas, and what drivers have to face in terms of when they do have an opportunity to rest. That a lot of the time, the opportunities are limited, the locations aren't great, and it's really difficult to actually get good quality rest in terms of the environment you've got to deal with. So that was a very, very quick snapshot of some of the data that we've collected relevant to sleep and fatigue, to the use of substances and suicide that we've collected in driving health. Greater in-depth discussion of those factors is all available at drivinghealth.net. But what we're going to move on to today is we're going to be speaking to our experts who are experts in these particular areas. So first, I'd like to introduce Professor Shantha Rajaratnam. Shantha is Professor and Deputy Head of the Monash School of Psychological Sciences and Deputy Director of the Turner Institute for Brain and Mental Health. I refer to Shantha as a specialist in sleep, and you can see on the screen at the moment, a much greater detailed list of what Shantha does. I'll hand over to Shantha. He'll give you a much better introduction of himself and where Shantha has a key role in the driving health study. He's one of our investigators in the study. So Shantha, welcome.
Thank you, Ross, and it's great to be here. And so, look, my area of expertise is in sleep and circadian medicine, and I have a particular interest in the effect of shift work on our sleep-wake cycle and how this impacts our health. And so I've done quite a lot of work understanding how the heavy vehicle industry could improve sleep health for drivers, and therefore have impacts on improving overall physical and mental health as well. And so my role in this work has been to inform some of the collection of data on fatigue, sleep habits, and substances used to try and overcome fatigue as well.
Great, thanks very much, Shantha. I've just realised the numbers are out of order on my slides, but that's okay. The next person I'd like to introduce is Darren Black. Darren is the CEO of the AusHelp Foundation, which is an industry-focused mental health and suicide prevention organisation that focuses its support on high-risk male-dominated industries, which of course truck driving is one. AusHelp has been a fantastic supporter of the Driving Health Project. I'm really excited to have Darren speaking to us today. Again, Darren will do a better introduction than I will. Darren, can you give us some background on yourself and AusHelp?
Yeah, thanks very much, Ross. Pleasure to be with you on the panel today. So yeah, look, AusHelp, the AusHelp Foundation has been in the business of suicide prevention in high-risk, hard-to-reach, largely male-dominated blue-collar industries now for over 20 years. The Health in Gear project is a project of AusHelp, which we kicked off in 2020, sponsored by the National Heavy Vehicle Regulator with federal government funding under the Heavy Vehicle Safety Initiative. And the purpose of Health in Gear was, in essence, to design an intervention to improve the mental health and well-being of drivers. The process we went through was extensive in terms of consultation and co-design. We literally talked to hundreds of drivers, industry safety experts, industry associations, wives of drivers, to really get a strong sense of the environment, the risk factors, the protective factors before we then went into designing a series of interventions. We conducted the first phase of the project last year. That was essentially the pilot or the trial phase. Some really, really positive results coming back from that initial phase. And we're now into phase 2 this year, which will see us, does see us out on the road right now, delivering what we call the truckies tune-up, which is essentially a roadside health check for drivers. It has both a physical and mental health screening component to it. So we're planning to roll out a whole bunch of those this year and literally get out there and support hundreds of drivers across the industry. We're starting to see some really positive buy-in now coming back from industry for that frontline face-to-face approach to preventive mental health, which is great.
Thanks very much, Darren, and thanks for joining us with the discussion panel today.
Thank you.
The third guest that I'd like to introduce is Professor Dan Lubman, who's worked across mental health and drug treatment settings in both the UK and Australia. He's Director of Turning Point, Australia's leading national addiction treatment research and education centre, inaugural Director of Monash Addiction Research Centre, and Professor of Addiction Studies and Services at Monash University. Again, Dan is very familiar with the Driving Health Project. He's one of the co-investigators and had a lot of input into the Driving Health study and continues to. Dan, would you like to give us some background?
Yeah, thanks so much, Ross, and it's a real pleasure to be here today. My research interest and my professional expertise is in the area of addiction and understanding alcohol and drug harms and where they play out and what we can do to prevent them. And we're particularly interested when we talk about addiction. We're talking not just about alcohol and illicit drugs, but also about prescription medications as well. And we know there's a strong relationship between issues, physical health issues that drivers can have. I think that Ross has talked about, particularly around physical pain, injuries, and then risk of becoming addicted to prescription medication. So it's been a real pleasure to be part of the study team to understand what is happening in terms of drivers' health around alcohol and drugs and the roles they play, particularly looking at injuries and the relationship to prescription medications. And, you know, it's a real delight to be part of the team and to think about how we can use the key learnings from the study to inform a whole range of approaches to improve driver health.
Great, thanks very much, Dan. We'll be back in just a moment through the magic of this platform for a panel discussion. Stay with us. Okay, welcome to the discussion panel. I've got a few questions that I'm going to start throwing at the people on the panel, and we'll see where the discussion takes us. My first question is for Shantha. Shantha, we can see from driving health data that sleep is really challenging. What does healthy sleep actually look like in terms of hours and patterns and that sort of thing?
It's a great question, Ross, and it's a great question particularly today because it happens to be World Sleep Day today, and it's a day when we in the field do what we can to really promote a healthy sleep and answer this question. So the first thing about healthy sleep is an adequate amount of sleep. So we know that professional organisations in sleep medicine around the world have recommended that for adults, there is usually the minimum amount of sleep that's required by a healthy person is about 7 hours per night. And so, but there are individual differences. There are some inherent short sleepers and some long sleepers. Typically, and a good way to understand whether you've had an adequate amount of sleep is to look at the quality of your functioning when you're awake. Do you struggle to wake up without an alarm clock? Are there episodes of involuntary lapsing into sleep? Are there, do people comment? Do you struggle to keep awake? Do you find that the day is difficult in terms of being cognitively fatiguing and so on? All of these could be indicated. Do you rely on caffeine excessively to keep awake as well? These are indicators of an inadequate amount of sleep. The other key factor around, aside from the amount of sleep, is the quality of sleep. And the quality of sleep can be impacted by your behaviour and the environment in which you're sleeping, but it can also be impacted by the presence of any one of a number of sleep disorders. Sleep disorders are incredibly prevalent in our community, and we know in heavy vehicle drivers certain disorders are particularly prevalent. And these are obstructive sleep apnea, insomnia, and shift work disorder. Now, these disorders can not only impact the quality of sleep, but also immediately affect your wake time functioning and have flow-on effects to impact a number of those health outcomes, Ross, that you were presenting earlier, cardiovascular health, metabolic health, mental health, are all significantly impacted by these untreated sleep disorders. So that's really a factor that you can do, because there are good screening methods for these disorders, and there are effective treatments available as well that will improve the quality of your sleep. So 2 factors: duration of sleep and quality of sleep.
I was just wondering if Dan or Darren, from your perspective, do you have any impact with your expertise around how do you help people if they're having difficulty with sleep, whether it's to do with Shantha mentioned the follow-on effects of mental health. Any comments?
Go, Dan.
Yeah, no, thanks, Ross. I think there's a number of big issues that we know that are common complaints, be they pain, anxiety, and sleep. And I think the key thing is trying to understand what's driving, any complaints in those areas. So when we're thinking about sleep, as Shantha, has given a really great overview of the types of issues that impact on sleep. But, from a professional point of view, it's about understanding what is keeping people awake, or what is impacting on people's sleep, and really understanding that, and understanding sort of what strategies people put in place to sort of deal with challenging sleeping or fragmented sleep. And from my perspective, obviously, that's where often people are turning to substances to sort of help them get to sleep or stay asleep, or taking substances the next day to sort of keep awake, because they've had sort of really poor quality sleep. So the key thing for me is to really understand the person's own perspectives on, what's wrong with the sleep and what they're doing to address that. And then looking at that impact, and we know that sleep impacts on mental health, we know that it impacts on so many other areas, and really understanding, sort of holistically, sort of what are the range of things that we can put in place to sort of make sure that we not only address their sleep, but many other things that are impacting on that sleep that they're struggling with.
And Ross, look, I might add in a couple of things here from our research and practical experience, with a lot of drivers, and we're very conscious that sleep and fatigue is a key issue faced by drivers, and we take a holistic approach to drivers' health and well-being. We look at sleep, we look at diet, nutrition, exercise, social connections. Those holistic factors that affect health and well-being. We know this is a common issue, and there are real challenges in the industry of environment and workplace demands that impact upon good sleep. So we tend to take a very pragmatic approach to trying to coach and support drivers around small tips, small practical things they can do to help improve their sleep. Things, for example, around intake of coffee and those high sugary drinks. Not continuing to consume coffee and high sugar drinks into the afternoon and evening. Trying to be conscious of a routine that enables sleep, a sort of wind down process at the end of the day, getting off technology and screens and so on, and trying to have more of a kind of, relaxed entry into that, more normal sleep pattern. Just as a couple of examples. So we're involved in, very pragmatic sort of day-to-day conversations with drivers about these very real topics.
Sorry, Shantha, did you want to?
Ross, I was just going to add, so I completely agree with Dan and Darren's points there, and so getting to the root cause of the sleep problem is really critical. One of the root causes of sleep problems, as Darren alluded to, is what we call sleep hygiene, and so that is a factor that is very much in our control, and people underestimate the impact. So what I mean by sleep hygiene is all of those behaviours and habits and aspects of the environment that are going to impact upon sleep. Darren mentioned caffeine. and limiting the amount of caffeine that you use close to the time you go to sleep. Also looking closely, as far as you can control it, because we're going to come into truck stops and things at the moment, but your sleeping environment as well. Also looking at when you eat and when you use devices and all of those things to try and optimize the quality of your sleep. The final factor that's a real challenge, particularly for shift workers of all types, including drivers, is that often we're trying to sleep at times of the day when our brain, the clock in our brains, called a circadian clock, is promoting wakefulness. It's sending a signal for you to be awake, and you're trying to override that signal and go to sleep. And this is a typical challenge that shift workers face. And so working through that is important to understand. It can also, when people have repeated difficulties trying to sleep during the day, that can give rise to a different type of sleep disorder, such as insomnia. And so it compounds itself. And then you get, you start resorting to using substances and things to try and promote your sleep. So that's another classic challenge that truck drivers have as well, is trying to sleep during the day when the biological clock is promoting wakefulness.
There's a quote from a driver that really sticks in my head that we collected through our interview phase of the project, where drivers said that they're supposed to be driving when they're sleepy and they're meant to rest when they're alert. And that sort of, for me, just underlined that challenge that you described there. So while we're on this topic, Shantha, how you talked about some things that are within your control. Sometimes drivers are in the position where they're not sure what their next job's going to be. So they might have to be responsive to whatever job comes up, or they might not have a regular schedule, or their schedule is interrupted by other things. How does, I guess, not being able to plan for sleep, what sort of impact does that have?
Well, it's a real challenge, Ross, because we know that firstly, exposure to sleep deprivation or prolonged wakefulness will have an immediate impact on our alertness levels and our cognitive function and so on. But if we are exposed to sleep deprivation against a background of inadequate sleep already, then the effects are much more severe, and there is much greater risk of an accident occurring. So that's why it's so important to be, as far as possible, in a well-rested state before being exposed to a period of sleep deprivation, for example, overnight work. Now, I've seen examples in my own work where I have consulted with drivers who tell me that, not only are they unaware of their schedule that's coming up, but they're also, anxious when they're sleeping because they're trying to monitor information as it comes in, because their schedule may be changing and they may be required to work. Now, that is a really a high-risk situation, because you're interrupting the sleep that is, that the individual is trying to achieve before getting on to a shift and being in a rested condition. So I think this is something where we really need to see employers recognising that planning ahead is a really important part of protecting the safety and health of the workforce, and giving schedules as far as possible in advance, and protecting the time off with minimum interruptions. All of these are really critically important. We've worked with organisations before. We recognise that this area of fatigue management is really something of shared responsibility. The individual has responsibility to avail themselves of an adequate, time for rest and sleep, but the organisation has a responsibility to ensure that the workplace and the work schedule, in this case, is also safe and is giving the person adequate opportunity to prepare.
Thanks, Shantha. Darren, I saw you sort of nodding at a particular point there. It sounded like that's a story you've heard a number of times.
Oh, indeed, and Shantha talks about those sleep hygiene factors, and but also the environmental factors are absolutely key contributors to this as an issue for drivers. We're commonly in discussions about rest area design, quieter places for drivers to sleep on the roadside. So there are factors, I guess, here that are within the driver's control that they can personally take responsibility for. And that's what we tend to focus on, is trying to help, coach and support around those personal hygiene factors to assist with sleep. But then there are those external or environmental factors that really require a whole of system kind of approach and response to trying to improve some of those things for drivers. And I think we're going to come back to talk about, taking a systems approach perhaps a little bit later in the conversation, aren't we?
If we can get there, I'm enjoying it too much. my next question I've got is for Dan. It's shifting gear a little bit, but Dan, there's often, I guess, a focus on illicit drug use amongst truck drivers, and often that's in a response, like you mentioned, to try and perhaps to stay awake and deal with the pressures. And there's certainly a lot of testing within the industry around illicit substance use. And even in our survey, we found a small proportion who told us that they took amphetamines, either currently or in the past. Now, the aim here is not to name and shame, it's to actually identify, well, if this is happening, there must be some reasons for why that's happening. From your perspective, what do you think there are some of the reasons for that focus on illicit drug use in transport? But then also, what approaches might be the most effective in addressing drug use in the industry?
Yeah, thanks, Ross. That's a great question. And, obviously, we want to keep people safe, and it's important that we have safety on the road. So mixing alcohol, drugs with driving obviously is a no-go, and it's understandable that we have, policies in place to keep people safe on the roads. But as you say, there are people in the survey who identified using sort of illicit drugs, and generally, those drugs are generally stimulants, and those drugs are used primarily to keep people, awake, to combat fatigue, something that we've already talked quite a lot about. And so it's really important to think then about, to take a step back, I suppose, and think about, well, when we're thinking about driving health, why is it that people are struggling to stay awake? Shantha's already touched on many of those things around fatigue and shift work. What are the strategies that people are putting in place, and are those strategies working? How do we identify people who might be struggling, and how do we make sure we have strategies in place to look at how to help them in a way that might be more supportive? And if we are identifying people who are using, who are at risk, what's the responsibility as employers to make sure that we identify them early, that we have good channels in place to provide support, and to make sure that people get the right type of treatment that they might need if they're developing a problem with those substances. So I think the message there is, it's really important that we keep people safe. It's really important that we're honest about this issue. We design sort of alcohol and drug policies in the workplace that are collaborative, that people understand that there's good mechanisms for support, good pathways to care, but also that we make sure that, we have a culture, in place that promotes health and safety, and make sure that we look out for people amongst our colleagues who might be struggling and might need additional support. The only thing I might just mention in that space, though, is that the other thing we just need to be clear about is around impairment. So the critical thing here is we're talking about, we don't want people driving impaired. And one of the challenges I think we have in this space is we have a really great way of detecting impairment for alcohol, which is around blood alcohol concentration, that tells us some really good information about how impaired people are. But in the drug space, what we have is really drug tests that really just tell us about absence or presence of drug in the system, and doesn't tell us anything about impairment. And we know that some of the drugs that we're talking about, like stimulants, can be in the system, in your saliva for 1 to 2 days. So even though you might have used it at the weekend or outside of work, it could still be detectable, on drug testing. So we need to be careful when we're thinking about putting policies in place around drug testing, that we're not penalising people for the fact that they might be using drugs in their spare time, but that it's detectable during work time. And we've got to be really careful about how we think about that difference between drug use and impairment and the policies and supports we have in place.
I mean, my understanding of the policies in place at the moment is that they're quite punitive, and from your work that I've read in other areas, I'm assuming that how you described it is actually wrapping supports around people rather than actually punishing them for doing that. Is there a role for that in transport, do you think?
Very much so. I mean, I think it's fair to say that 1 in 5 Australians will struggle with an alcohol, drug, or gambling problem at some time in their lives. We all know somebody in our family, in our social circle, in our work space, in our community groups that are touched in some ways by addiction. And so it's such a common issue. We need to think about how we identify it and how we support people. And taking a very punitive approach means that the behaviour goes underground. It means that people don't put their hands up early. And we know that addiction is incredibly stigmatised, and we have up to a 20-year delay in people putting up their hand for help. If we're going to have a culture at work where we're really, keen to support people's health, both physical and mental health, we need to have ways in getting people to acknowledge what those issues are, acknowledge, where they can go to get support and feel like they are going to get supported. And I think for too long, I think alcohol and drugs has been just seen as sort of poor choices and bad people. And the reality is it affects so many of us. And that, like, we've been much more open in terms of how we combat mental health. Addiction, alcohol, drug use, and problematic use fits into that mental health umbrella. And we need to be much more honest about that conversation, because we know that it contributes and alcohol and drugs and mental health go together so closely that we can't ignore one without the other. And, it's an important conversation that we need to have.
Do you have a comment, Darren, before I throw, I've got a question for you, but did you have a comment on what Dan just mentioned?
Look, it's probably just a comment in agreement with Dan. Ross, I mean, look, we know from our discussions with lots of drivers that alcohol and use of other drugs, there are relatively high levels of dependency, and we also know that they are underreported, as are sleep-related issues like sleep apnea. And we know drivers are very reluctant to disclose sleep apnea, as well as dependency on and use of alcohol and other drugs, and fundamentally because of licensing requirements, and they're concerned that if they disclose these matters, then from a compliance and licensing perspective, they may lose their livelihood. So to your point there, I think we need to find better ways to support drivers, being conscious that these issues are real and present across the industry, but find ways to support drivers that are not seen as punitive and more supportive, rather than, the regulator's going to, or the police are going to get involved and I'll lose my license. So it's real, and it's a very major part of the problem that we face currently.
I guess that sort of cuts to, the main part of what my question was, is that what things do you see that help drivers to see that their actual individual health and well-being is actually valued within the industry? What things have you seen that could actually be amplified to tell drivers, well, their health and well-being is the most important thing, more important than the wheels turning?
Well, it was a great question, Ross, and we've sort of touched on a system response or approach to this, but in transport and logistics industry, I talk a lot about chain of responsibility, and our view would be that there's a role in this for industry and employers, there's a role in this for regulators, there's a role for government, and there's even a role for community, the broader community. And I'll give you a couple of examples of what we mean. In terms of drivers' health and encouraging drivers' health, there needs to be a recognition of the pressures, the unique pressures that drivers in the heavy vehicle industry face. And I'm talking about the pressures of time deadlines, costs, schedules, and, you know, from an employer and industry perspective, being more realistic about those things. So it helps to relieve rather than increase pressure on drivers. An immediate case in point would be the massive increase in fuel prices that we're all experiencing right now, which we all know fuel prices tend to fluctuate 5%, 10% week to week. But in the last couple of weeks, fuel prices have gone up 50 to 100% around the country. That's a cost of delivery pressure that's immediately being absorbed by drivers and the trucking companies, and who are then forced into that sort of very immediate pressure negotiation with the supply chain, with the buyers and customers around, well, who's going to pay for the price increase? So I think the point I make here is around an awareness, a greater awareness at an industry, at a sector, at an employer level of the pressures, the very direct pressures that drivers face. And starting to think more about, you know, I think across the industry, what we've observed is that most transports and logistic businesses are very, very good generally at maintaining their fleet. And what I'm talking about here is the maintenance of the vehicle. Because we know, you know, if the maintenance schedule on the vehicle doesn't get kept up through regular servicing and care and attention, the vehicle breaks down, and, you know, we're going to be in trouble in terms of meeting our supply chain requirements. But we need to take a similar philosophy to the driver. And, you know, hence the approach we've taken is very much focused on the health and well-being of the driver. Yes, we need to maintain our vehicles. We also need to maintain and support our drivers, because without the drivers, you know, literally the country comes to a stop. Businesses are not able to meet their requirements. Groceries don't get delivered to the supermarket shelves. There won't be fuel in the bowsers. So it's you know, philosophically and systematically looking at this and saying, yeah, absolutely, we need to start to treat the health and well-being of the driver as important, or even more important than the vehicles, the machines that they drive to deliver the produce and the goods across the country. And, you know, we are seeing companies out there who are starting to take a far more proactive approach to this, looking preventively and proactively at preventive health and wellbeing and support to drivers, which is a really, really good thing to see. And, you know, from our perspective, AusHelp and Health and Gear, you know, we urge and encourage that, and are here to support that.
Great, thanks, Darren. I've got more questions for you, for all three of you. I've enjoyed chatting to you. Thank you very much. But what we're going to do now, we're going to switch now to answer any of the questions that have come through from people watching the presentation today. So just bear with us, and we'll be back with some more questions.
And thank you, Ross, Shantha, Darren, and Dan, for bringing us to a very productive session today. Now we will come to the Q&A or discussion session. We are glad to receive some questions from our participants. One of the questions from Richard asked about, do we have any comparison between like other male-dominated industries such as farmers and agricultural workers with like trucking company? The trucking industry, for example, for mental health or suicide.
Do you have anything to add there, Darren?
Look, a little bit. I mean, we work across industries, principally in building and construction, transport, logistics, as well as doing some work in farming and agriculture. And what we know from that research is that all three of those industries are overrepresented in terms of national suicide statistics, unfortunately. The worst in the nation, if you like, in terms of those is in the building and construction industry, and transport and logistics run second. We also know that certainly in some farming and regional and rural communities, you've got very high rates of mental ill health and suicide as well. And they're all as a result of, what we would call, the social and economic and environmental factors that contribute to high rates of mental illness and worst case to suicide in those industries. So yes, there is data available, and we look closely at this data to enable us to design our programs and where we should focus.
And yeah, I can add more on top of Darren's, because like when we analyzing the compensation data, we compared the transport industry to other male-dominated industry, including agriculture, construction, and mining. And we found the risk of making a compensation claim is higher in transport industry compared to other dominated industry. And for mental health, I think the overall mental health claim rates, it's also higher in transport industry, especially for bus driver and train drivers. So I guess that's bring another question, because it's male dominated industry, and being a male, they are just less likely to seeking help for their mental health condition, especially they may have some stigma in their industry, like of having a mental health. So just wondering any comments or any suggestions from the panel to targeting this group of people.
Well, I'm happy to weigh in here again, because this is very much where we focus at AusHelp, and the reasons that we work in those industries is because it's absolutely because there is high stigma in those industries associated with any discussion or disclosure around mental ill health, and because of that, we also have low help-seeking behaviour. So the approach we take and very much encourage is to try and work with industry and work with employers in those industries to normalise the conversation around what is health and well-being and what is mental ill health, to make it more permissible to talk about those topics, not just on Are You OK Day, but any day. To create peer support structures across organisations and workplaces, that people in those businesses know that there are people they can talk to, mates, if you like, across their network and across the workforce that they can talk to, without necessarily having to put their hand up within the management structure and go and talk to HR, for example, and disclose a potential mental health issue. So very much about normalising the conversation, having presentations, education and training around mental health and well-being. What does good look like? What does it look like? And what does it feel like if you're struggling? Normalising those conversations, creating peer support networks, and of course ensuring that people know where they can go if they need support.
Yeah, thank you, Darren. So we are going to the second question from Katilin. She asked, given the death data is from TW Super, so does it include owner driver? And have you found difference in the health and lifestyle risk between the big company drivers and small business or owner drivers?
So with the life insurance data that we presented, it was the very first time we've used that data source from a life insurer in terms of those claims. We were very focused, and Ting, you actually led the analysis on this, so correct me if I'm wrong here. But we were very much focused on the cause of death. We didn't necessarily have a lot of the information around the type of driving that particular person might have done. So with that data source, that information wasn't really available to necessarily be able to drill down to the other levels that we have been able to in other parts of the Driving Health project.
I guess and also for the Driving Health survey, we did look at the difference between owner driver and employed driver, and I think like there is no significant difference between those two groups in their like health and lifestyle risk. But I think this brings to another question. It's like, do we need a different approach, or do we need a different intervention to targeting this like owner driver, because they are not employed by company, so they may, facing a more time pressure or finance pressure during their work?
I'm interested. I'm just interested in Shantha's opinion. Has he had differences with, I guess, the type of people that work, that maybe if someone's own business that they need to work strange hours, or whether it's actually, that they just happen to be allocated to a shift? Sorry, Darren, you jump in after. Sorry.
Yeah.
So look, we would expect that, Ross. The expectation is that the fatigue management programs in larger organizations are going to be more developed than what an owner driver is going to be able to typically implement, and the demands of being in that environment. We haven't specifically tested that and examined it, but that's what we would expect, yes. Darren, did you have anything further there to add?
Oh, look, really just to say, yes, the reason, in fact, that the Health in Gear project was first conceived was particularly to focus on the owner-driver cohort. And that was because we knew that the employed driver workforce, working for the major employers, the likes of Toll Group and Linfox and so on. If they were working for those companies, then they had support. They had supports in place. They had EAP systems. They had education, training, and wellbeing. There's a lot of stuff in place to support those drivers, but not so the owner driver. And so our focus was very much in the beginning on owner drivers, those small business operators, the sort of mum and dad, because they don't have access to those supports, and they're trying to do everything themselves, from drive the vehicle, load the vehicle, invoice the customer, get there on time, maintain the vehicle, make sure registration compliance. They're trying to do it all and work through all of the industry and environmental pressures and risk factors that we discussed, and just make a living. And so, yes, we focused there first, principally because the research showed us that they were at the highest risk.
Ting, can I just comment on another point of the previous question that you asked about the male-dominated industries?
Yep.
One of the things that we find in heavy vehicle drivers, and we talked a little bit about this earlier, is the extremely high prevalence of obstructive sleep apnea. And obstructive sleep apnea, so studies range in terms of the estimates of the prevalence, but it can be as high as 40% of the drivers that have been studied would show some degree of sleep-disordered breathing, sleep apnea. And sleep apnea has a number of impacts immediately on it. Disrupts sleep and causes pressures on the cardiovascular system and so on. But one of the most immediate manifestations is also depression and mood disturbances. So here we have a workforce that we know is at high risk of a particular sleep disorder that can contribute to a significant risk of depression, sleepiness, and so on. And so it provides us, going back to the question about how do we tackle these sorts of things in a male-dominated industry, I've found that bringing the conversation to topics like sleep, and I'm interested in Darren's view on this. Now, of course, sleep apnea comes with some challenges in terms of fitness to drive and so on.
Mm-hmm.
Bringing the conversation to sleep is often kind of less stigmatized and gives you an entry into being able to kind of open the conversation to mental health, substance use and so on. It can kind of lead into a deeper discussion on those topics.
I just say yes, Shantha, that, I mean, often we lead into the conversations with drivers that it may end up in a conversation around mental health, but almost always the conversation starts around diet, exercise, sleep and fatigue, you know, how are things going at home, you know, with your family and friends and staying in touch. So those are the conversations that typically open the discussion, which may then, because we know that they're all connected, right? In terms of someone's mental health, we know that diet and nutrition and exercise and sleep and social connections are all fundamental towards good, you know, mental health and well-being. But that's typically how we start the conversation. It's often around sleep or one of those other one of those topics, rather than, you know, we never start a conversation with, you know, are you feeling happy or sad or depressed, or, you know, answer this question on a scale which will give us a rating around anxiety and depression. You know, we may end up in a conversation like that, but that's never where it starts.
Thank you, Darren. So due to the time limit, there's only the time for one question. So the question for Shantha: do you have any thoughts on the power naps? Do you think they work, and are they effective? Is it better to have the power nap than no nap at all?
Okay, so in 1 minute, a power nap is an effective short-term strategy to offset the effects of sleep deprivation. The critical issues are that they need to be short in duration. Longer naps will start to cause sleep inertia, the impairment that occurs due to going into the deeper stages of sleep. So that needs to be well managed. And then I emphasize short-term strategy, because a power nap is not a substitute for an adequate amount of sleep in the main sleep period. So that also needs to be kept in mind.
Interesting. Well, okay, I believe all of us have been enjoying the discussion today. And well, I think we need to close the Q&A session, but we will come back in a second for wrapping up the seminar. I want to thank you for all attending to our fourth Driving House event in the 2022 Healthy Working Life Seminar Series. We have another 2 free Driving House events this month. The next event is on Monday, 28th March, 12:30 to 1:30 p.m. Dr. Elizabeth Patriot and our 2 special guest speaker, Travis and Rod, who are drivers, they were together to talk about truck drivers' perspective of staying healthy on the road. So make sure you have registered for the next event. For more information on the Driving House project, go to drivinghouse.net. And hope to see you there. Thank you.